Being here, I want to thank the mayor, the judge, and Chief Nim Kidd, the chief of the Texas Division of Emergency Management, for joining us today to visit about the challenges that Victoria has been facing in grappling with COVID-19 and, candidly, the success that is met in responding to that challenge. The state has very carefully monitored the growth and expansion of the COVID-19 numbers in Victoria. First, there was a massive increase in the people testing positive, and then you saw the inevitable increase in the number of people being hospitalized. And unfortunately, we are seeing an increase in fatalities. When we began to see the increase in the people who were hospitalized, we knew there needed to be a robust response and assistance, both from the state and the federal government. So I called Vice President Pence and said that we need medical staff in Victoria, Texas. And I was very proud to see the Vice President and the administration respond very strongly and very swiftly to make sure that medical personnel were provided to the region to assist local healthcare providers in providing the health care that was needed by people in Victoria. I'm also pleased to see the way that the numbers are now moving in the right direction. The number of people testing positive, the number of people being hospitalized are both on the decline. People need to understand there is one reason for that decline, and it's not because COVID-19 doesn't exist in Victoria like it used to. COVID-19 still exists in Victoria as well as across the entire state of Texas. The reason why the COVID-19 numbers are going down in Victoria as well as in the state of Texas is because people have begun to adopt the practice of wearing a face mask, of maintaining safe distances, of using hand sanitizer, of not going to locations where people are so close to each other that it will lead to the transmission of COVID-19. Bottom line is Texans realized how dangerous COVID-19 can be and how serious and swift the transmission of the disease can occur, and that if they are not vigilant in protecting their own safety, is so easy for it to transmit to others. Well, in getting to visit with local officials, we were able to determine exactly what their needs are at this time, as well as what their needs may be going forward, including, among other things, talking about what the needs will be in this school year that's beginning as we speak, about the reality that one way that education will be taking place, at least in the near term, is remotely, and that will necessitate even more technology devices, whether it be hotspots or whether it be things like laptops or other types of technology, to make sure that all of our children all across Victoria will have access to the best quality education they can receive under the circumstances that we're dealing with, making sure that education can occur in the safest possible setting. But bottom line is I'm very, very proud of what everybody has done here. And also I want to especially recognize Jeannie Morrison, who's right behind me. You're a great representative with whom I've stayed in contact, as well as somebody who's not with us here today, but also that I work with, and that is Senator Colkhorst, making sure that all of the needs by local officials and the community will be met. And so, Jeannie, thank you very much for being here. And I forgot, I think am I going to the judge? So, Judge Zeller, thank you for taking the time to visit with us, and thank you for all that you're doing.
Well, thank you very much, Governor. On behalf of our community, we very much thank you and Chief Kidd for being in Victoria this afternoon. I know our conversations and our interaction is not new. We've been in constant communication since early this year when COVID first became an issue, and I know Chief Kidd has reached out to me personally on numerous occasions, and so we appreciate the communication channels having been open and in place, but it's especially nice to have the productivity of an in-person visit like we did a little bit earlier, along with all the folks who are at the very center of our community's response and handling of the COVID situation. I think that was very productive. You know, if we had our say in things, COVID would not be a pandemic we'd be dealing with this year. We would all pick other activities to be engaged in, but this is something facing our community, our state, our nation, and our collective success in overcoming it is absolutely a top priority, and that takes teamwork within our community, with our state partners, state leaders, all the way up the food chain to Washington. I know Congressman Cloud is back here, and I echo your remarks, Governor, about Representative Morrison and the wonderful work that she does. Again, I largely want to say thank you for being here, for the teamwork, the collaboration, and despite our frustrations along the way, again, our collective success in this effort is our top priority. The mayor and I have a community of less than 100,000. I can't imagine the burden of nearly 30 million constituents to try and assist, but I appreciate you being here, and we thank you for your work.
Thank you, Judge. Mayor?
Governor, I want to echo the judge's sentiments in thanking you for being here today. It's not, oftentimes government seems so distant and far away and not close to the people, but you put a human face on the state government today by being here, and we appreciate that very much. And I appreciate that you're here to not tell us what we need, but ask us what we need, and be willing to respond to those needs that we have here throughout our, in talking to the people that run our hospitals, people in charge of emergency management, which I think we have an extremely qualified group. I think, Chief Kidd, you shared that sentiment with me. I think we're very fortunate in Victoria to have the level of emergency response that we have here. And I can't say enough about Jeannie Morrison. Jeannie and I go back to junior high together, so we've known each other a long time. And she's been a very good source of advice to me, and a source of getting resources we need. And I'm sure that she talks to you quite often. And I'm glad to see Congressman Cloud here today that brings the element. So Victoria has a lot of representation here today from people who can make things happen and understand the problem. And I think that you have a real personal stake in this, Governor. I can tell by the way that you respond to questions and ask questions, and I think that's remarkable. And I appreciate that very much, the care that you've shown in being here today. So I want to thank you, and I don't know what the future brings, but I think with the resources we have in place, and if we can keep the line of communication together, we will do okay. We'll be just fine. Thank you, sir.
We'll do it. Thank you. By the way, Jeannie told me that when you were in middle school, she was in pre-K.
Well, I'll defer to her memory.
I do want to thank Chief Kidd. So, among other things, one thing Chief Kidd does, he does assist us in making sure we are capable of providing the medical personnel that's been needed, and with his assistance, working with the Vice President as well as the federal government, we've been able to provide more than 110 medical personnel staff to Victoria, and more than 450,000 masks to Victoria. And the state of Texas is ensuring that all public schools in the state of Texas, including right here in Victoria, will have access to all of the PPE they need throughout the entire coming school year. And that's largely because of the hard work by Chief Kidd. Chief?
Thank you, Governor. And I want to start by thanking the folks that are standing here behind me and the work that they've done, the leaders in healthcare and local government, but most importantly, the men and women out on the streets and in the hospitals that are taking care of the citizens of Victoria and surrounding area. Our job is to continue to provide personal protective equipment, testing supplies, and staff where needed. Assurances from the governor is we're not taking any of that stuff away until the time comes, and it is nowhere near right now. So, Governor, the team is ready, the team is strong, the team behind you is doing a remarkable job here. Just very gracious to be here with them today. Thank you.
Thank you. We'll take some questions.
Governor, one of our local school districts started in-person classes in July, and within days, inductions were
Sure, there's some plans in place already that were added by the Texas Education Agency. One is whenever there is anybody in a school setting that tests positive, the school has the ability to close down the school for a number of days and go to remote learning. And during that time period, they are able to sanitize the school and stabilize it for the returning students. Second, there is always the alternative. If there is an outbreak of COVID in a school, a local public health authority has the ability to close that school for a certain period of time to make sure that it gets stabilized. In fact, that was done this past year. In fact, I should say earlier this year, in January of this year, with an outbreak of the flu, not here, but in other parts of the state of Texas. And it can be done like that for COVID-19 also. Bottom line is this, and that is the approach taken by the TEA, the Texas Education Agency, is to ensure that the first and foremost issue for public schools is the safety of students, teachers, and parents. And second, in order to achieve that, the Texas Education Agency has provided those schools the flexibility they need to make sure that they will be able to adjust their schedules to accommodate the health challenges they will face as they work their way through COVID-19.
Following up on that, Governor, some both local health officials and local school officials across the region have expressed confusion about where exactly their authority begins and ends. Can they expect additional guidance about when they'll be able to lawfully close their schools?
Well, I think the guidance is pretty clear, and the way it works is that the locally elected school boards and the superintendents those school boards hire, they make the initial decision about when to open up schools, and they can choose July or August or September or whenever they want to open up schools. And they also make the decision about how to open up schools. And they can open it up remotely, they can open it up in person, or they can open it up in some blended strategy. What was made clear is that local public health authorities, they do not have the authority to make a school closure decision 3 months in advance of when a school may be opening up, because neither they nor anybody will know what the status of COVID-19 is going to be 3 months in advance. What local public health authorities have always had, and what they still do have, is the ability to close down any facility, whether it be a school or other type of business location, whatever the case may be, if there is a public health reason for that closure.
Okay, I have a question.
Sure.
How many schools are still waiting for the PPE? We've got word that some teachers are paying for what they need out of their pocket and being reimbursed later. Should we expect us to receive some more PPE equipment anytime soon?
Sure. I can tell you that there should be no school that is still waiting for PPE. If there is a school that doesn't have PPE, they should contact Chief Nim Kidd of the Texas Division of Emergency Management, because he has enough PPE stockpiled for how long?
We have 46 different warehouses that have hundreds of millions of masks and face shields in them. So if there's some one-offs, we want to have the conversation with them. But to your point also, nothing stops a school from buying its own personal protective equipment and seeking reimbursement through the feds and through us, but we will continue to push PPE. Some of the larger districts, we ship to them directly, and from that they disperse to other schools. Some of the smallers we sent into regional armories and to racks and working on moving that back and forth. But there's not a PPE shortage, so have them contact us and we can work it out directly.
Okay, how can somebody reach you if they're looking to get some of those equipment?
I'll reach back out through TEA. If it's a school district, we have all of their contact information. If you'll give me the name of the school district when we're done here, we'll make contact with them.
So they've already provided more than 60 million masks to public schools across the state of Texas, more than 560,000 gallons of hand sanitizer. And that's what they did before the school year began. And they have plenty of supplies and ongoing supplies that will be available for all public schools across the entire state of Texas.
Just to add some light to Latona's question, Charlene Estrada with the Victoria Television Group, the Edna ISD actually did receive PPE, but they were informed that they wouldn't be getting face shields until mid-September. So I think there may be a delay in part of the PPE that they're expecting.
We'll
Sure.
reach out to Edna. We'll have some there tomorrow.
And I did have a question. It's a two-parter. Why has testing dropped so significantly in recent weeks when the positivity rate, the 7-day positivity rate, has been spiking?
Sure. So the answer to your first question really begins with a question, and that is what led to the massive increase in the amount of testing that was taking place in July. Let's go back in time to when Texas began to open up. When we began to open up back in early May, we were doing about 20 to at most 25,000 tests per day at the time. The goal was to get up to 30,000 tests, and we got up to 30,000 tests perhaps in the early to mid-June timeframe. As we began to see an increase in the positivity, we were able to get additional testing supplies and were able to do massive surging testing operations in several ways. One is we went and tested every single nursing home in the state of Texas. And then in addition to that, there were certain hot spots where we were able to surge a massive number of testing kits in the Rio Grande Valley, for example. Now, beginning this week, we're seeing a replication of that surge in Harris County. Because of the status of Harris County, we have 4 facilities set up that will collectively do 5,000 tests per day for 10 days. That'll be 50,000 tests. We sporadically are involved in surge testing like that, and that the robust large number of tests that you saw come back in July were the result of those surge testing operations combined with testing every nursing home in the state of Texas. That said, what you can expect going forward is going to be another likely increase in the number of tests run, in part because of the surges like I just told you about in Harris County, but also in part because, once again, because of new testing capabilities, we anticipate being able to constantly test in every nursing home in the state of Texas. And these will be the quick turnaround tests, so people will be able to learn about them that same day. Also, I have been working with some labs in the state of Texas to increase our ability to do testing in schools, knowing how important that will be. So going forward here, especially in September, but maybe before then, you should anticipate seeing another increase in the number of people being tested. Let me tell you one thing about where we are seeing positivity rates arise from. So when things begin to open up, they kind of coincided also with Memorial Day and school getting out and graduation ceremonies and other social events. And also the opening up of bars and the opening up of tubing operations. We did see an increase in Texas of the number of people under the age of 35 testing positive, where more than half the people testing positive were under the age of 35. However, that was not unique to Texas. It was replicated in states across the United States. An area where we are seeing a large number of positive tests coming back are in gatherings, family gatherings, backyard gatherings, neighborhood gatherings. There's a reason why this is happening, I believe, and that is some people feel if they're just with family members, even if it's with 50 family members, they can let their guard down. They don't have to wear a face mask because they're all just family. Or if they are just hanging out with their friends, they feel like they can let their guard down. And that turns out not to be the case. There have been several family-only events in areas ranging from the Rio Grande Valley up to Dallas, Texas, that led to massive spreading events. So my message to everyone is that COVID-19 exists everywhere, in Victoria, across the state of Texas, across the entire globe. Wherever you are, with whoever you are with, you need to wear a face mask, face guard of some type. You need to keep your distance from others, frequently sanitize your hands, otherwise you will be contracting COVID-19 and you will be spreading it. Last thing I want to say about this, and that is we are finding, as I said, a large number of young adults and teenagers who are testing positive for COVID-19. Many of those are categorized as asymptomatic, meaning they are showing no symptoms. They don't feel sick at all, but they may go to their parents' or their grandparents' house and they can spread COVID to the parent and grandparent and maybe even cause them to die. That's exactly why we need young adults to wear face masks because they may be carrying COVID-19 without knowing about it, and they may be killing a family member without knowing about it.
Two more questions.
Governor, over the weekend, President Trump proposed a new relief package to replace the unemployment benefits that recently expired. This proposal would require states to give a 25% match. Would you support a plan like this?
I had the opportunity to speak with the Vice President and Treasury Secretary Mnuchin about this yesterday. 2 points about it. One, they said at that time that we, being the states, could use CARES Act funding for that match. They said, however, that negotiations were ongoing between the administration and Congress, because what both of them want to achieve is to be able to fully address the unemployment benefits needs of people who are without a job because of no fault of their own. And I feel that the negotiations will be very fruitful. And I think that we will see in the coming days a better package come out of Congress that will provide those benefits, as well as provide other funds that will assist, could be state and local governments as well as people who are unemployed, to make sure that everybody's going to be able to get back on their feet a whole lot quicker.
Last question.
Abbott, Thomas Columbia. Where do you see Texas in a year from now?
A year from now? So a year from now, Texas will be where we were exactly a year ago. Texas will be leading the nation in the most new jobs created. Texas will be the home of bustling industries that long existed, but also new types of businesses. Because one thing I have found during the course of the pandemic is that my phone has been ringing off the hook by businesses in other states and other countries that are now more than ever realizing that Texas is a superior state in which to locate their business. And there are businesses like Tesla, where I had a recent announcement, that are continuing to come to our great state. And so there will be more jobs, a more robust economy. And Texas will go from being the 10th largest economy in the world to the 9th or 8th largest economy in the world. That's where we will be a year from now.
Thanks, guys. We gotta go.
All right, thank you so much for joining us. A little recap right here.